What is psoriasis? A persistent, long-lasting disease. How is it a skin disorder? Affects the life cycle of skin cells. Forms thick silvery scales and itchy, dry red patches.
Symptoms may include
Red patches of skin covered with silvery scales. Small, scaling spots. Dry, cracked skin that may bleed. Itchy, burning skin. Thickened, pitted, or rigid nails. Swollen and stiff joints.
Your skin is composed of 3 layers. The outer layer, or epidermis, is made up of cells called keratinocytes. They begin to form at the bottom of the epidermis. They divide, pushing already formed cells upwards. By the time the cells reach the skin's surface, they are no longer alive. These are the dead skin cells we constantly shed. This process usually takes about 30 days. In psoriasis, it takes only 3 to 4. And instead of falling off, the dead cells pile up. Psoriasis results from a problem with a type of white blood cell in the immune system called a T cell. T cells normally detect and fight off foreign substances. In psoriasis, T cells attack healthy skin cells and trigger an immune response. Blood vessels in the skin get larger. Other white blood cells enter the epidermis. The T cells release messenger chemicals called cytokines, which tell the keratinocytes to reproduce and mature much faster than normal. New skin cells form and move to the surface too quickly. They build up as the thick, scaly patches on the skin's surface that characterize psoriasis.
Risk factors include family history, viral and bacterial infections, stress, obesity, cold weather, smoking. There are many types of psoriasis, but the following are common. Plaque, nails, scalp, psoriatic arthritis. Diagnosing psoriasis: a physical exam, looking over medical history, examining your skin, hair, and nails. Treatment of psoriasis.
Depending upon the severity of your psoriasis, appropriate treatment may involve lotions, ointments, sometimes light therapy, oral or injected medications. These can be used alone or in combination for better, faster results. The first steps to treating dry or cracked skin is to regularly use a moisturizer. For more extreme redness and scaling, a prescription topical treatment may sometimes be necessary. We'll go through a few of these now, and you can pause to take notes to discuss with your doctor later. Corticosteroids are the most common topical prescription for psoriasis. These reduce inflammation and temporarily clear skin by suppressing the immune system's T cell production. Your dermatologist will explain any side effects and dressings if necessary. Be aware that psoriasis can become resistant to corticosteroids over time. Calcipotriene, or vitamin D that comes as a cream, also reduces skin cell production and is most useful for small patches of psoriasis. Retinoids is a different class of medication that act by slowing the reproduction of skin cells. These should not be used by women who are or plan to become pregnant. Now, ultraviolet light therapy can help some patients through careful sunbathing outside or treatments in a medical facility. This works because UV light kills active T cells on the skin that cause the symptoms of psoriasis. It's generally safe, but carries a small risk of burning and also potential for skin cancer. Ultraviolet light B, or UVB light therapy, is performed in a medical facility for mild to moderate psoriasis that hasn't responded to topical applications. One advantage is that it can be controlled to treat only the affected skin areas that have psoriasis. PUVA combines ultraviolet light A exposure with drug sorlin. It's reserved for serious cases and requires a heavy time commitment with at least 25 treatments over 2 to 3 months before clearing occurs. To maintain control, additional treatments may be necessary. Now, an entirely different class of medications are the biologics. These medications are rapidly becoming a first-line treatment in cases that cover more than 10% of the body. This is because these biologics are easy to use and cause very few side effects. The drugs are made from proteins that stop immune cells from attacking the skin. They can be delivered by self-injection or through an IV. Finally, oral medications are also used to sometimes treat psoriasis. Because of the side effects here, ranging from nausea to very severe complications such as cancer, these prescriptions are generally reserved for patients who have not responded to other therapies. Methotrexate, for example, is an anti-cancer medication that can dramatically clear flare-ups. There is a risk of liver disease, so patients will be monitored very closely. Pregnant women and men or women trying to conceive should not take methotrexate. Cyclosporin is also reserved for very severe psoriasis cases because it suppresses the immune system so thoroughly. Any patient on cyclosporin will be closely monitored for any serious side effects, including infection. Once you've started any of these treatments, scales should recede first, with skin returning to normal thickness over several weeks. The redness may take several months to improve.
Lifestyle update. Take daily baths. Use moisturizers. Best time to put is overnight. Expose skin to small amounts of sunlight. Eat a healthy diet. Avoid drinking alcohol. Avoid triggers.